October is National Audiology Awareness Month, a time to raise awareness about hearing loss. Approximately 48 million Americans have a significant hearing loss, and 15 million of them avoid seeking help. The audiology specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery talk about the importance of having a diagnostic hearing test.
What we're finding is that younger people now need to come in for baseline hearing tests because we live in such a noisier environment that maybe our parents did. The music, just their jobs, there's just a lot more noise involved. It used to be, 60, 65, but if you're 50, 55 and you feel like you're starting to struggle, you should come in and let us test you so we can have a comparison. So if you feel like it's changed, we know what type of change there's been. Basically, we recommend people come in every 2 years for a hearing test unless they say that there's a problem in between, because then it could be a medical problem. A hearing test consists of 3 components. There's air conduction, which is through headphones or insert headphones, speech testing where we have them repeat words back to us, and bone conduction, which actually stimulates the hearing nerve. So all 3 of those components are required by law so that we can tell what type of hearing loss you have. A lot of times it's a family member that sends the patient in, but if the patient's, honest with themselves, they'll notice that when they're in a group setting, they start to not include themselves in the conversations because they're not quite hearing everything and they don't want to be embarrassed by answering incorrectly. So they just kind of withdraw from the conversation. We always tell people, just stop and look at your surroundings. How often am I having to ask people to repeat themselves, or how often am I not hearing it so I don't answer? Those are kind of the signs that maybe you need to start getting a hearing test so we can see where you're at.
If you suspect you or a family member has hearing loss, the best place to start is with a hearing evaluation by a licensed specialist. You'll find information on the hearing and audiology services available at Lake Ear, Nose, Throat, and Facial Plastic Surgery when you click on the Audiology Awareness Month story link icon on our homepage, yourhometownhealth.com.